Let's dive in. We'll start with the first section of our training today, which is understand the problem. So let's imagine that you were awarded a grant to improve colorectal cancer screening in Chatham County, say. So that'll be our focus and our example throughout the training today. In order to decide where to intervene when you first start out, you'll need to review existing county level data to assess the colorectal cancer incidence rates and screening rates in Chatham County. So here are some sources for data that you can use to conduct your assessment. And we've included a comprehensive list of these data sources in a handout that I emailed to everyone this morning. So feel free to look at that in your own time. To find our screening rates in Chatham County, I'm going to start with this source that's on our list called the State Cancer Profiles. So from this page, I'm going to select North Carolina from the drop-down menu, and that will take me to this page where I can browse state-level cancer data. So after selecting incidence up in the top bar, I can look down to see what the current colon and rectum cancer rates are. So here I can see that North Carolina's rate is slightly lower than the US rate at like 36.8. If I want to get more specific to county level data, I can click the little map symbol here, which will take me to this page. And this is where I can select the data that I want to see by county on the map that I'm about to create. So under the data group, I want to make sure to select screening and risk factors because I'm trying to get to my screening rates here. And then I'll select colorectal cancer screening for the topic. And then my screening and risk factor, I picked home-based FOBT in the past 2 years or ever had a colorectal endoscopy so that I can capture both types of screening in the data. So once you've clicked the options you want to see on your map, and there's a whole bunch of other ones you can explore later, you just click the Generate Map button down at the bottom, and that will take you to your map. So here, if you hover, once you're on the actual website, if you hover your mouse over a county that you're interested in, you'll see the screening rates pop up. So when I hovered over Chatham County, I was able to see that the Chatham County screening rate is 58.3, which is kind of low if you look at it compared to that scale that they have on the right, because it's the orange color. I do want to mention that these are estimates based on statistical models, which combine information from the Behavioral Risk Factor Surveillance System and the National Health Interview Survey to correct for any non-response or undercoverage bias in the area. But they can give you a good sense of what the rate is and how it compares to the rest of the state and to the country. And now it's time for a quick activity. I want you to go ahead and try to play around with that, the Cancer Profiles website. I'm going to put the link in the chat for you too, and see if you can find the screening rate for your county. Here's the link in the chat. We have just a few minutes. And once you find the screening rate for your county, feel free to share it in the chat so that we all can see. And if you can't remember the steps, you should be able to look back in the slides that I sent out. And if you have any questions, let me know too. Anyone find a rate yet? Nice, Lenore County, 61.8. Thank you, Megan. All right. Amanda sent in Craven County, 68.8. Oh, okay. Well, I think for the sake of time, okay, we got Wake County, 72.8, nice. I think we're going to move on for the sake of time, but this is something that you can play around with as much as you want after the training as well. But I just wanted to show you that. So let's go back to where I left off. Okay. So after you've determined your screening rate, the next step you'll want to do is conduct additional research looking into what might be contributing to your screening rate, especially if it's low, like Chatham County's rate was a little low. So you can do this by reviewing the literature and existing data and collecting any new data, or even gathering stakeholder input and creating your own maps and diagrams of the process. So we're going to talk about some of that today. And as we do that, and as we investigate the different factors that might be affecting our screening rates, you want to pay attention to where they fit on the social ecological model. Thinking about where the factors land on this model can help you understand the relationship among different factors, but it also can help you think about ways that you can target your intervention so that it might target factors on multiple levels. So that'll make sense, I think, as we keep going here. So thinking about colorectal cancer screening, I heard many of you work in colorectal cancer screening or other cancer areas. What are some possible barriers to colorectal cancer screening that we might encounter in our literature search, or that we might discuss with our stakeholders, thinking about all of these levels? Feel free to add some to the chat if you can think of any, or come off mute if you want to share.
How much time do you have? There's a lot.
Yeah, exactly. There's a lot.
Insurance and transportation are the two that I would think of first.
Yeah, and I think that was actually the very first one that I put as well. The lack of health insurance, or even, yep, you might not have a PCP, which someone put in the chat too. Thank you, Sydney. Low health literacy, that's on my list too. Yep. Feel free to keep them coming. Yep, fear of finding out. Yep, I'm gonna bring mine up too as you guys add them to the chat. So I have cost, and that could be cost to the patient or cost to the health system. Lack of transportation to the colonoscopy or to return the kit. I'm getting lack of education, mistrust of the health system in the chat. Lack of provider recommendations, language barriers that came up with low health literacy. Fear or embarrassment of the colonoscopy process. Yeah, I like Jennifer's, don't want to send in the stool sample either. Yeah, and then even just forgetfulness. That was something that came up when I did a quick literature search. You know, you might forget to return your kit. So these are all different barriers, and they all land in different places on this social ecological model. So it's helpful to kind of keep those in mind and see what you see in the literature when you're trying to kind of figure out where to start. So with that said, lack of interpersonal support. Now we're going to explore another resource to find factors sort of like what we just brainstormed. So this is a fun resource because it can help you explore sort of where your county ranks among the rest of the state as well. And so a link to this is also included on the handout that we sent. So from the home page, if you click Explore Health Rankings, and then down in the bottom left, add Find County, or in the Find County Rankings box, type the county that you're interested in. On the next page, it will take you to the overall health outcome rank for that county. So despite the low colorectal cancer screening rates in Chatham County, it actually is one of the healthier counties in North Carolina. So that's pretty good for Chatham County. If another fun thing about this tool is that you can look at all kinds of different indicators and possible factors down at the bottom as you scroll through the tool. and it'll show you sort of where they rank with other states and with the US when compared to the US. And it'll also show you if there's been any trends upwards or downwards in the factors. And another nice thing that you can do is you can select show areas to explore and show areas of strength, so that it'll highlight those for you and you can quickly see some important factors. So when I did that and I scrolled down, this is what I saw. And you can tell that the purple or the kind of brown, purpley, this is like more like a red brown color, I guess. Those are the areas of improvement or opportunity to explore. The purple color are the areas of strength where Chatham County is doing really well. So I scanned through these and I decided that adult smoking and uninsured are the areas to explore that are most related to colorectal cancer screening. And then as far as the areas of strength, I noted these 3 possible areas of strengths as relevant and possible places that we could leverage when we're considering a colorectal cancer screening intervention. So we've discussed reviewing existing data. You'll also want to collect new data, and this might be in the form of interviews or focus groups, surveys, or even public meetings, as well as direct observation. And when you do this, you want to make sure that you work with your stakeholders through the process, because your stakeholders have in-depth knowledge of the local context and they're invaluable to helping you design your survey or interview guide, or even answer the questions in your survey or your interview guide. So I'm going to focus a lot today on interviews, but I just wanted to mention that the process for interviews is pretty similar to focus groups and even the public meetings that you could do. So just kind of keep that in mind. Direct observation may include things like taking notes during a meeting, observing a process, or even doing an environmental scan where you go to an environment like maybe a pharmacy or a convenience store, and you complete a checklist to see like what's being sold or how it's being sold or something like that. So those are different forms of observation that you can do to collect data. Surveys are also a helpful way to get a lot of data from a lot of people, but you may not be able to get the same depth and context that you can get from an interview. So that's why we're going to talk a little bit more about interviews today. But always keep in mind when you're choosing what method you're going to use, what resources you have, how many participants and people you should talk to, as well as who should be at the table. Your audience and figuring out who the right people to talk to is really important to consider as well. So we talk a lot about stakeholders. They're the ones who really know what's going on and who you should really be talking to. They may be different groups depending on what you're working on or who you work with. It could be healthcare systems and hospital partners, providers, staff, or even patients, government agency partners, or even academic partners. Who are some stakeholders that you work with in your work? Anything that I didn't add here? You can send it in the chat or come off mute. Financial donors, yes. Patients, that's a really, really good one. Other CBOs. What is a CBO?
Community-based organization.
Yeah, sorry, I couldn't get the mute button.
Thank you. Okay, great. So going back to our story here, you decide to collect additional data. You're going to interview clinic staff as your stakeholders so that you can identify their priorities and to understand any contributing factors. So the first thing that you need to determine is what you actually want to know and get out of the interviews. So a good way to do that is to think about a few overarching questions that you want your interviews to answer. So here are a few that I came up with. One is colorectal cancer screening a priority for the clinic? What resources and staff time does the clinic have available to work on a screening intervention? And lastly, I'm curious what barriers to colorectal cancer screening are encountered at the clinic from the stakeholders' perspective. So these are the overarching questions I want to know. And then once you think those through and kind of determine the purpose of your interview, then you can start to write the actual interview questions that you'll ask to find out what the answers are to these overarching questions. So the actual questions that you ask on the interview, during the interview, will be a little bit different than these 3 questions here. So when you're writing out your list of questions, you want to keep in mind how the questions all flow together. They should flow logically, perhaps like in the order of a process. And you should also start, if you can, with the least sensitive questions and save any questions that are more sensitive for the end. That can help you kind of build rapport in the beginning. You don't want to dive right into things that might make someone feel uncomfortable. And a good rule of thumb is to have about 5 to 6 main interview questions with a few follow-up probes or alternative questions. You don't want it to be too long because you want to be mindful of your stakeholders' time, and you want to make sure that you really get the answers to what you're looking for. So there are many ways to write an interview question depending on what you want to know. And here are a few examples. We also made a handout with these so that you can quickly reference them when you're writing your own questions. But the first type of question is called a grand tour question. And this is when you ask your respondent to generally describe a typical space or time or event. And these can be really good starting questions because they're not very specific and they kind of give you the lay of the land of what you're talking about. So I have some examples here. Like you could say, I've never been to this clinic before. Can you tell me about working in this clinic? And you can ask, the more general questions about the time or event or the people. So a mini tour question is similar to a grand tour, but it's asking about a smaller experience, and they tend to be more tangible for respondents and often lead to pretty useful descriptions. Like in this example, could you tell me what happens in the pre-screening appointment at the clinic? So you're asking about a very specific process. Opinion or value questions are fairly self-explanatory. They're used to understand how people interpret specific events or issues, and it will reveal their opinion or norms or values about the topic. So what do you think about patients who refuse a colorectal cancer screening test? This is the example I have here. The native language questions serve to remind participants that you, as the interviewer, want to understand experiences in their own language or in their own words. So you might tell them in the interview that you want their specific perspective, since everyone has different attitudes. And basically, you want to communicate to your stakeholders, to the person that you're speaking with in the interview, that they are the experts. That they're the experts and that you're ignorant of their of what they know. You want to learn from them. So framing your questions like, how would you refer to your friends? Just ask them what terms they use for the things that you're talking about. Or you are a member of this community, you know about this. So can you tell me about this experience? And these are the last few question types we're covering today. One is hypothetical. We use this a lot when we're collecting formative data to see how an intervention can work. And this is actually a question from one of our projects where we're looking to do cancer screening out of pharmacies. So a hypothetical question is asking the participant how they would respond if a certain scenario happened. So here, how would you respond if your pharmacist offered you a home colorectal cancer screening test? Feeling questions, they get at their emotional experiences. So this is definitely an emotional question here. How did you feel when you received your abnormal colorectal cancer screening test? And lastly, the knowledge questions. These are just used to understand what people consider factual information, what they already know. So tell me in your own words, what are the colorectal cancer screening guidelines? When conducting your interviews, you want to think on your feet, and you want to always come back to your purpose and to those original overarching questions that we designed. Because sometimes the questions that you'll wind up asking weren't on your guide originally, or sometimes your participant will answer a question you had on your guide. So your guide is helpful, your list of questions is a helpful guide, but you don't have to stick to it exactly. And you want to just make sure that you go back to what you really want to know and what your overarching questions are. And it's also helpful to take notes so that you can remember any follow-up points that you want to bring up. So now I want to talk a little bit about some types of questions that you should avoid. So the first is a yes/no question or close-ended questions. And these often get close-ended responses that don't go much deeper than simple like one word or yes/no answers. So these questions, I do want to say that these questions can work, and I do like to use them sometimes if you're following them up with a probe right afterwards. So like you may ask a yes/no question like, does your clinic have a provider champion? And then based on what they say, you'll have a follow-up question. Say they don't have a provider champion, you could ask about that, you know, what you don't want to say why, but ask them to tell you a little bit more about that, or yeah, so basically what I'm trying to say is the yes/no close-ended questions can work if you're trying to figure out kind of which direction to take the interview, and then you follow up right after that. But otherwise, we want to try to avoid them. So the why questions, you want to avoid those because they can sometimes come across as confrontational or like you're applying that there's a right or wrong answer. So it's best to try to avoid them. A lot of why questions can also be worded differently to ask the same questions. Like instead of asking a clinician, why are your screening rates so low? You might say like, what do you think is impacting your current rates? So just something to think about when you're wording your questions and how they come across. That's also true with leading questions. These are questions that might lead someone down a path of fixed response options, and kind of they tend to suggest the answer that you want. And they also tend to be rather assumptive. For example, if you were to ask a clinician, how satisfied are you with your rates? It might lead them to say that they're more satisfied than they would have if you simply just asked them how they felt about their current rates. So just kind of be mindful of like the words that you use in your questions, and if you're leading them towards a certain direction, or if you're actually soliciting their thoughts. And then the last question to avoid is a double-barreled question, which is basically two questions written into one question. And so that can confuse your respondent because they may only answer one part of the question, and you may not even know which part of the question they answered. So that can lead to some unclear or incomplete responses. So to avoid double-barreled questions, it's best to just separate the two pieces out separately. Okay. So now that we've covered different types of interview questions and what to avoid, let's practice writing a few questions. So here's one of our overarching questions that we came up with at the beginning. What would you ask your stakeholders in order to answer this question? Is colorectal cancer screening a current priority for the clinic? So take a few minutes, think about it, maybe jot some down. And if you'd like to share once you have thought of some, feel free to add them to the chat or come off mute. So without asking this question, what question would you ask to get at the answer for this question? What is your clinic's CRC screening rate? That could work. That's a question that might not get a lot of context, though. It's a little more close-ended. Ask, do you talk to all patients over the age of 45 about colorectal cancer screening? That again is a yes/no question, but that's okay. You're getting at what they work on. Nice. Any others? What screenings does your clinic currently provide or discuss with patients? Yeah, I like that one a lot. That's open-ended, and it also is leaving it up to them to mention if colorectal cancer screening is what they are currently working on. And then that will help you determine if it's a priority for them. Okay, I'm gonna click over to the one, these are the ones that I thought of before we started today. You could just ask them to tell them about, you could say, tell me about your clinic's current priorities. By asking them that, you open it up for them to say what their priorities are, whether cancer screening is a priority or not. They'll be able to list what comes to mind off the top of their head. You may ask, tell me about your current colorectal cancer screening initiatives at your clinic. What are they currently doing? And that can help you gauge whether it's a priority for them. And even just one of those feeling questions, how do you feel about your clinic's current screening process? So those are just a few examples. There's many more questions you could ask, but I just wanted to have you guys kind of start thinking about questions. And there's really no wrong or right way to do it. Okay, so I mentioned probing when I was talking about using closed-ended questions. Probing is a technique that you can use to get your participant to tell you a little bit more about something or to subtly steer them back on track with the topic that you're talking about. So to effectively use probes, you want to be really familiar, again, with the purpose of your interview and those overarching questions so that you know which responses you should follow up on for more information or which ones you should steer someone away from. And it's also good to avoid additional probes if you notice from maybe any body language from a patient, if they are seeming like they're frustrated with the way the questions are going or something's uncomfortable for them, those are situations where you would not want to further probe anymore on. So on this slide, I have a few examples of types of probes. One would be a direct probe where you just ask them to tell you what they mean when they say a specific thing, and you just directly ask them to following up on something that they said. A passive probe is where you show you're actively listening. You just say, to kind of encourage them to keep talking, or even just pausing helps sometimes. If someone only gives you a little bit of information and you pause, sometimes they'll just keep talking, and so that can work to your advantage. And indirect probes are where you ask, tell me more about that, anything else you want to say about that topic, and those can be really helpful too. So here's a very simplified example of how you can use probes and how they might be helpful. So let's say that despite asking an open-ended question like this one here, how do you feel about your clinic's current screening process? Your respondent's not very chatty, and they simply respond with, not that great. So that's not a lot of information for you to take back to your team or your stakeholders. So you can use probes to try to get them to elaborate a little more. Maybe you will just pause and let the silence influence them to add a little more context to what they're talking about. Or you could follow up with another probe and say, can you tell me more about that? And maybe, like this person did in this case, they'll add a little bit more information and say something like, well, we don't have a great way to track fit kits. So that's just an easy example that shows you how probing can help get someone to tell you a little bit more about something that you're looking into in the interviews. So here's another quick activity. I have some interview questions here that could be written a little bit better than they are. And I'm curious if you guys can help me think through why these questions are not as great as they could be and how we can make them a little better. And in your slides, feel free to go back to this one that we covered to reference this as you're thinking about what's wrong with these questions. So thinking about that first one, why are your screening rates low? What's wrong with that question? Sounds judgmental. Yeah, those why questions can sound confrontational or judgmental. How can we make that question better? Well, we can reword it so that it's not a why question. What do you think is contributing? How can we raise your screening rates? How can we improve your rates? Okay, so take a more of a positive spin to that. I like that. I'm going to move down to just the last one now for the sake of time. Can you tell me about your pre and post visit screening processes? What's wrong with that question?
That's a really big question.
Yeah.
And it's 2 parts.
Yes, exactly. It's a very big question, and it's a double-barreled question with 2 parts. So we could split that question up into 2 separate questions, but you made a good point that even then it's a really big question. So you might have to follow up with additional probes for each one of those once you divide them into 2 separate questions. But great job. What contributes to your low screening rates? Yes, that's a great one for that first question. Awesome. Thank you all for participating so much. Okay, so we're going to move on. Make sure I can cover everything. Okay, so I just want to talk a little bit about note-taking and recording. There's a lot of different ways that you can capture what you learned during the interview. And the gold standard in like qualitative research methods is to record with 2 recorders and to transcribe your recordings. But that's not always necessary, and it takes a lot of time and it's expensive. So I wanted to make sure that y'all knew that it's also fine just to have note takers or to use these are fun note-taking tools like Google Jamboard or Mural. They're basically like digital flip charts. If you're meeting via Zoom and everyone can collaborate and add to the notes, we have links to all these on the resource list. Also, if you're meeting in person, flip charts and sticky notes work just fine. But I did want to make sure you guys had some resources for transcription if you were interested in them. So they're listed here in order of the more rigorous types of transcription and more expensive types of transcription that you can have, like hiring professional human transcription services to transcribe your recording, all the way down to the Zoom cloud recordings, which can be helpful if you're recording your Zoom meeting to the cloud. It will generate a cloud recording transcript for you. And I've used those before, and they are messy. You do need to kind of listen to the recording and clean them up a little bit. But if you already have a Zoom subscription, they don't cost anything extra. And so we do use them sometimes. So lots of ways you can take your notes. And then when it comes to summarizing what you learn in the interviews, I like to use this simple template. Now you could also use this as a note-taking guide when you're conducting your interview, especially if you have a note taker who can help you. On the left side of the table, you want to add your interview questions, and then you simply put your summary on the right side. And some tips for writing the summary: you can jot down just some simple bullet points as long as it's a complete thought that you'll be able to, understand when you go back to the notes again. It's helpful if a question wasn't asked or answered to make note of that, so that you know why that summary is blank in your notes. And just keep in mind that you want to summarize it well enough so that anyone who reads the summary should get a sense of what was said in the interview without listening to the recording or without reading the transcript. And if you can, add quotes. That's a fun way to tell the story that you're trying to tell. So here's an example using the 3 questions we have on the left with some simple summaries here. So just looking at the first one, if you asked, tell me about your clinic priorities, and they told you about how COVID vaccination is a big priority and CRC screening is a big priority, you could simply just, bullet point the answer to the question there in your summary. And then let's say you conduct a bunch of interviews. You can add them to this type of summary table where you put your questions in the column headers, and then the rows all represent a different interviewer or interviewee, sorry. So this is helpful so that you can quickly glance down the column for one question and see what multiple different people said about it. And it can help you start to identify any themes or patterns in all the interviews that you do. So if I did 3 interviews here and I'm looking down at what their clinic priorities are in that first column, I can see that while they all have multiple priorities, 2 out of the 3 people that I talked to happen to say CRC screening as one of their priorities. So just an example of how you can use these types of tables to quickly summarize and compare what you learn in your interviews. So after conducting interviews with our stakeholders, back to our story here, we've concluded that improving fit kit tracking is a priority, and transportation is a current barrier for patients that stakeholders told us about in those interviews. So once you have this information, you decide that you and a group of stakeholders in your team are going to meet to further discuss what you learned and work together to establish your goals for improvement based on the data that you collected. So thinking about writing your aims and your objectives, you want to ask yourself questions like which demographic had the lowest cancer screening rate, what's contributing to the cancer screening rates, and also what's most changeable and what resources are available to address the problem. And it's also important to think of and ask like what factors were a priority for your stakeholders. So a lot of that information we already have from all the data we collected. Here are a few different prioritization tools that you can use. You can, working with your stakeholders, anonymously rank the different factors. You can go through multiple rounds of voting, or you can make a strategy grid, which I'm going to show you how to do today. So taking a step back and thinking about the factors that we found today during our data search, within the existing data, we saw adult smoking and uninsured come up. That seems like they could be something to explore. And then during those interviews that I talked about in my hypothetical scenario, we identified that tracking fit kits was a priority and a difficulty for the clinic stakeholders, as well as the transportation to complete screening for the patients. So creating my strategy grid, I can list those factors that I identified on the left, and then add 2 more columns for feasibility and need. And I can start to think about which of these factors would be the most feasible for me to intervene on with the grant funding that I have, and which factors of those are the most impactful to intervene upon. So thinking about each one of these, I thought, I was trying to think like which ones were feasible, which ones were the most impactful. So for something like adult smoking, the feasibility is rather difficult. It may require a clinic intervention at the patient level, or even cultural or policy change at the environment level. And then the need, I would say it's medium, because while adult smoking is a risk factor for colorectal cancer, it doesn't directly impact screening rates, which is what we are funded to focus on in our example. So for the uninsured, that one is medium, may require policy change, or even just finding lower cost services for patients. So it might be a little easier than the smoking. And it's also a high need, because the insurance status directly impacts the screening rates that we're trying to work on. And we found it to be an area of improvement for Chatham County, our population. Fit kit tracking, that's another one that should be fairly feasible. It would require some changes to clinic workflows, but it's nothing that hasn't been done before. And there's lots of strategies and interventions to help with that. And the need is high because it directly impacts the ability to screen more patients in our case. And it was something that was noted by stakeholders as a priority. And transportation is another thing that a lot of interventions exist to help with, like mailed fit interventions can help with that. So it's fairly feasible compared to the other factors. And then as far as the need, it also directly impacts patients' ability to be screened and was a stakeholder priority. So looking at these factors, we decide that these 2 are the ones that are most feasible and most impactful, 2 factors that we can work on. So, once you've identified where you want to intervene and focus your intervention, you can start to determine what you want your actual SMART objectives and goals to be. So many of you might already know about SMART objectives, but it's just a nice format for writing your goals. You want to make sure they're specific, measurable, attainable, relevant, and time-based. So, think about who's your target population, what's your desired outcome, how are you going to measure your progress, and what will be considered a success. And then what is your time frame? You want to make sure that you can explain how much of what will be accomplished by when. So here's a screening rate, or not a screening rate. It's a SMART goal that's not actually very smart. Increase screening rates. How can we make that goal a little smarter? What should we add to that goal to make it specific, measurable, attainable, relevant, and time-based? Anybody have any ideas? Increase screening rates by X%, by X date, by doing X. Yes, that's perfect. Intended population, yeah. So on my next slide, I have some examples of goals that are a little smarter. They're probably not even the smartest goals that you could have. But increase colorectal cancer screening rates in Chatham County by 10% by 2025. So you're getting at by how much, you're getting at the population and the time frame. We also have, we will implement a colorectal cancer screening intervention in 2 Chatham County clinics within the next 6 months. And the last example, at least 75% of eligible adults in Chatham County will be screened for colorectal cancer by 2025. So it's really important to have specific measurable goals to guide what you'll do once you start looking for your interventions, which is what we're going to cover in the next session. So with that, we've completed the first part of our curriculum. And on the 14th, we're going to talk about how we can start to look through the literature to find different evidence-based interventions and adapt them for our context and to meet our goal that we just worked on writing today. And then on the 29th, we'll further discuss how to then implement those evidence-based interventions and then evaluate them.